biochemistry was more focused towards the reactions which people have difficulty in memorizing, but now they are focusing more on the clinical aspect, as I said, that is the vitamins and the diseases. If we had 560 as marks, the EIR was 3700, so you could have easily got a dermatology or medicine with that AIR. But in case of 2023, the rank dropped to 6700. That means you can get pediatrics with this kind of rank. With the same 560 marks in 2024, the rank dropped to 10800. So if you are in short of time, do all the majors, preclinical and the high yield shorts, that is the derma and ENT, you are going to get 175 questions. About 99% of the aspirants don't know that the pattern of NEET PG has changed from 2018 to now 2024. I have done an intensive research for 3 to 4 days and have summarized them into graphs, how the question weightage of NEET PG has changed, how the image based questions have increased, which subjects are of more high weightage, what are the changing topics, on what topics they are focusing more. And this video would help you to strategize your game plan, your NEET PG plan in a better way. So let's start the video. I am Dr. Mayukh Hazra, second year dermatology resident, and I had secured AI at 29 NEET PG 2023. So the NEET PG exam pattern has changed massively over the years. The main change that has come in the year of 2021 is that the question number had drastically reduced from 300 to 200, and during this only there was a shift of the NEET PG question pattern also, from a short stem, more of theoretical questions to more analytical questions and a moderate to long stem questions. In QBank, you practice 2018 to 2024 papers, but yes, they have changed, and I have divided NEET into two groups, that is the old NEET and the new NEET. That is, the dividing line is 2021. So the old NEET consists of 2018 to 2020 and the new NEET consists of 2021 to 2024. Now, preclinical subjects, in the graphs I have mentioned preclinical subjects, majors and the shorts. So preclinical subjects are the first year, second year subjects and the community medicine. The major subjects are medicine, surgery, OBGY and PD, and the shorts are the rest all subjects, that is eye, ENT, derma, psyche, anesthesia, ortho, radio. So in a basic graph only we can understand that the weightage of subjects have changed in the NEET PG. In 2018 to 20, you see this preclinical, it was a major chunk, about 50%, the pre and paraclinical. But in 2021 to 24, it was reduced to about 45%. So where does the increase happen? The increase happens in the major subject. So there is a more shift towards the clinical sides. Also the pre and paraclinical subjects are more clinically inclined. So the clinical major subjects has increased from about 30% to about 35%. The shorts is more or less the same weightage across the years. Now coming to subject wise, because in some subjects there is variation, among some major subjects there is a decrease, among some of the preclinical subjects there is an increase. So I have divided it into the old pattern, that is 2018 to 20, the new pattern 21 to 23, and 24 is also the new pattern only, but I am showing it in a different way. I am representing it differently to show you that it corresponds to that of 2021 to 23, that is the new pattern. And in this I have taken the shift 1 of NEET PG because it is the most characteristics NEET PG question paper. Shift 2 was more of a bouncer kind of, so I am considering the shift 1 only. In old pattern you can see that the percentage of anatomy was very high. So in the left hand side I have simplified by giving percentage, because if I had represented it by the number of questions, so it was a 300 questions paper, so it would have been much greater. So I have converted it into percentage so that you can understand the difference. Now in the old pattern it was about 5.5%. It reduced in the new pattern, the weightage of anatomy reduced, and you can see the similar change in 2024 also. Coming to the next subject, that is physiology, there is also a drastic reduce from the old pattern to the new pattern, and the corresponding same thing you can see in 2024 paper also. Coming to biochemistry, this is a bit of inverse, because in the old pattern the weightage was less, but in the new pattern the weightage has increased drastically to above 6%, and 2024 it has increased a bit little more also. In 2023 also it was a bit more only. So in these 2 years the biochemistry weightage has gone up drastically. Coming to pharmacology, there has been a reduce. It is looking more drastic because it is starting from 6.6, but it is not that much drastic, so it has reduced and further reduced in this year. So I have done the compilation, it took me 3 to 4 days. So if you are new to my channel, or if you haven't subscribed yet to my channel, then do hit the subscribe button. तुम लोगों के उंगलियों के ऊपर ही तो मेरा भरोसा है. And share it with your friends. Coming to microbiology, here also there is a bit of reduction, and in 2024 a corresponding change we can see. Coming to pathology, it is more or less constant. This year it has come to be more. Okay, it is more or less constant only. Coming to community medicine, it has reduced a bit in the recent years, and the same corresponding changes we can see in 2024 also. Coming to FMT, the percentage has increased, and this time also it has increased further. The weightage of FMT and biochemistry among the preclinical subjects have increased, and others have decreased a bit. Coming to I, it is more or less constant all throughout the years. We can say it more or less constant. ENT, the weightage has increased from old to new and further in this year. Coming to the next subject, that is anesthesia, it is a very less percentage subject, so it is more or less constant only. About 3 to 4 questions come every year. Coming to dermatology, in the new pattern it has increased, but this year it has decreased a bit. Okay, from the old pattern to the newer pattern, the weightage of dermatology has increased, but in this year it has a bit decreased. Coming to psyche also the weightage has reduced, and this year it has reduced further. Coming to radiology, yes, there is a reduction this year, though there were 6 questions, but there is a reduction in case of radiology also. In orthopedics, it had increased a bit, now decreased a bit, so more or less it is constant only. Coming to medicine, the weightage has increased in medicine, as we can see in the major subjects. Surgery also, the weightage has increased from the old to new pattern, and it is corresponding in the 2024. Pediatrics had increased in the new pattern. This year, surprisingly, the questions were a bit less. OBGY increased, and more or less it is constant this year. Image based questions, see, in image based questions in the old pattern it was 15.1%. It increased to about 21% in the new pattern, that is 2020 to 2023, and 2024 it has increased to 25%, that is 50 questions are image based questions. So the tendency of NBE to focus on image based questions is increasing day by day. Now coming to the conclusions which we can get from the graphs, लाइक तुम लोगों को ग्राफ देख के बहुत ही कन्फ्यूजन हुआ होगा, ये क्या दिखा रहे हैं. सो ग्राफ में उतना फोकस करने का ज़रूरत नहीं है. इनमें से जो कंक्लूजन आ रहा है उसको सुन के रखो. फॉलो द कंक्लूजन्स प्रॉपरली, these are only going to help you. In case of INICET, I won't make any kind of video like this because I have seen that the INICET weightage of subject changes drastically. Sometimes they give only 2 questions from optha, sometimes they give 12 from optha, sometimes they give 15 from community medicine, then next year they give only 2 questions from community medicine. So there is a huge variation. But considering NEET PG, the NEET PG more or less the marks weightage is more or less constant. From the graphs also you can understand that the 2024 is corresponding to the papers of new pattern of NEET PG. So we can take that the marks weightage of each subject of NEET PG is more or less constant only. Now in the conclusion we can get that the subjects where the questions have increased, that is biochemistry, FMT, ENT, derma, medicine, surgery, OBGY. The subjects where it has decreased is anatomy, physiology, psychiatry, radiology, microbiology, ortho, and more or less it has been constant, that is pharma, patho, commed, eye, anesthesia, pedi. If you want to take a screenshot you can definitely take, or else I would provide the whole PDF link in my Telegram channel. The link is given in the description box below. Now change in the questions. What is the change in the questions that has come? So the NEET PG pattern is changing to a more clinically oriented questions, like especially from 2023 the clinically oriented questions are a bit more. Now NEET PG focuses on common things like being a doctor in India you should be able to treat diabetes, DKA, these all managements, giving tetanus injections, these all you should know. Like AIMS focuses a bit on the internship, like which vials you need, which cannula you need, but NEET focuses on you as a doctor which choice you are going to take. So the questions are more and more focused clinically, and some of the questions you can solve by common sense also. Especially this year 2024, the stem of the questions were moderate to long stem. Till 2023 they were small to moderate stem, but this year the question stems were more lengthier and the crux words were hidden in between, so that caused a difficulty for students to solve the exam. But in case of recall only the crux words were given while solving, so it seemed to be easy, but actually while giving the exam it was not that much easy, as going through the recall seems to be easy. Number 3 is that the indirect questions, the frequency of indirect questions has increased in NEET PG from 2023 only. Like in 2023 a question was there, a patient has come to you with cheilitis, so you have to find out what is the vitamin deficiency. Now what test will you perform to determine the vitamin deficiency? So at first you have to know the vitamin deficiency and what is the test, that is glutathione reductase. So that was the answer. Like this they are twisting. In the GTs of marrow also you would see like this 3 twists are there. Till now the questions I have seen there are 2 twists. Till now in the NEET PG 3 twists haven't come, but marrow is focusing more towards that only. So there is a chance that 3 twist questions may also come. Image based questions are increasing. From the graph we have seen that from 15% to 25% the image based questions have increased, and now there is inclusion of time based sessions also, that is making the exam more and more difficult. So 40 questions in 42 minutes. Now change in important topics. I have studied few of the important topics. Previously for NEET PG, few topics were more important, but now other topics are becoming more important. Though NEET PG is not that much previous year topic focused as the INICET, but still then some of the topics are important for NEET PG. As I always say, NEET PG is a holistic exam. You have to have your holistic knowledge. It goes over the subjects, okay? But still if I have to mention, I can mention some. Like in anatomy they were focusing on the gross anatomy and the cadaveric sections more, but now they are focusing on the nerve injuries and temporomandibular joint. Physio they focused more on CNS previously in the old pattern, now they are focusing more on the action potential. Biochemistry was more focused towards the reactions which people have difficulty in memorizing, but now they are focusing more on the clinical aspect, as I said, that is the vitamins and the diseases, and these are very focused. So I have given it in a highlighter also. That means that they have very high propensity of being asked in NEET PG 2025 also. In pharma it was more focused on autonomic, now it is more focused towards the CVS. Microbiology previously more lab diagnosis was asked, but now drug of choice, listeria, newer organisms Like COVID-19 was also a hot topic when the COVID-19 pandemic just ended and started also. Uh, during those years from 2021 to 2022, it was a hot topic. Pathology, cell adaptations was important. Now hemat is very very important. Like a case, a clinical picture would be given or a peripheral blood smear would be given to you, and you have to identify that what is the investigation you are going to do next. After that, FMT injuries was most commonly asked. Now sexual offenses, 2023 2024, one question asked from sexual offenses. Eye optic tract was important. Optic tract is now also important. And 2023 and 2024, same questions of the dermoid of eye was asked. In ENT, ear was more focused previously. Now throat is more focused. In community medicine, epidemiology was more focused. Now vaccines and some common sense questions are also asked. In case of medicine, pneumothorax was important. It is still important. Pneumothorax is still important. But now ECG, like the atrial fibrillation, what is the management of PSBT? They would give the ECG and you have to tell the management, and the rheumat has become more important. In case of surgery, previously the GIT and the other systems were more important, but now the maximum weightage is that of general surgery. Previously in pediatrics, the milestones and scorings were asked, but now the torch infection is very much important also for the INICET exam. Previously, in case of OBGY, labor was more focused. Now PIH, infertility and amenorrhea. Infertility is growing more and more, so the things that are increasing day by day, they are only more focused in case of NEET PG. Like oncology is growing like hell, so oncology is more focused. Previously in dermatology, the classical vesiculobular disorders and psoriasis was asked. Now STI is more commonly asked. STI is a burning problem that India is not addressing, so it is more commonly asked nowadays. STI kits. Radiology basics were at first asked, previously iodinated contrast and the radiation exposure. Now more and more image based questions are asked. Orthopedics, more fractures were asked. Now also fractures are asked, but now the instruments are also frequently being asked. Anesthesia, previously it was more focused towards the drug. Now the most important topic, if you don't read anything about anesthesia, then also you should know the ACLS and BLS protocol. The CPR protocol, you have to remember it by heart. Previously psychiatry, it was more focused towards the classical diseases like schizophrenia, bipolar and OCD. Now addiction is more focused. The criterias of addiction, the alcohol de-addiction, alcohol related syndromes, what happen, they are more focused. Now coming to the changing competition also, because everything is changing, question pattern and all, it is becoming more and more difficult, but the competition is going way ahead of that. So you should know the changing pattern of competition and prepare yourself properly. This is not to give you stress, this is to make you motivated so that you prepare well for NEET PG 2025 or in future years you are going to give. So in NEET PG 2022, if we had 560 as marks, the EIR was 3700. So you could have easily got a dermatology or medicine with that AIR. But in case of 2023, the rank dropped to 6700. That means you can get pediatrics with this kind of rank. With the same 560 marks in 2024, the rank dropped to 10,800. That means you can't also get medicine or pediatrics, you have to take OBGY or surgery and the further streams. So you can see how the cutthroat competition is increasing day by day, and you have to prepare accordingly because this is a rat race and we don't have anything else to do for NEET PG. Now coming to the expected questions, this I have made by making an average of 4 years. So this is a predictive that how many percentage marks of questions are going to be asked, what is going to be the marks weightage for NEET PG 2025. So in anatomy it is about 7, physiology it is 7, biochemistry it is high weightage 12, patho high weightage 14, micro 12, pharma 14, FMT is a very short subject but 9, community medicine it is 15, ENT it is 7, eye it is 8, derma it is 5, radio, psyche and anesthesia it is 4 each, orthopedics it is 6, medicine it is 21, surgery it is 23, OBGY it is 19 and pediatrics it is 9. Now if we see the marks distribution, then preclinical you can see in the pie chart. Okay, majority is the preclinical still now, major portion is the major subjects and a short portion is the short subjects. So if I divide, then preclinical is about 90 questions you are going to get from the preclinical subjects. From the major subjects you are going to get about 72 questions, and from the short subjects 38 questions. So what are the high yielding subjects? High yielding subjects are not those who have the highest percentage of questions. High yielding subjects are the subjects which are easy to study and are very high scoring. Okay, the subjects which are very high scoring means giving the minimum effort you get the maximum output. So these are the biochemistry, pharmacology, pathology, OBGY, surgery, pediatrics, derma, ENT. Like medicine is a high weightage subject, but I have not kept it in the high yield group because medicine is a very holistic subject. If you read properly the pathology, pharmacology and biochemistry, then most of the medicine is also covered. Similarly, community medicine is a very high weightage subject, but it is not that much high yielding. Only few specific topics like vaccination, biostatistics, epidemiology, if you study, majority of the questions would be covered. Now take home points, these are the main points, so you should focus on this. What are the take home points if you are in a short of time, or if you are going to prepare and give your best shot? From this whole video, what we get in gist: if you lack time, then do all the major subjects, the preclinical subjects and the high yield short subjects, that is derma and ENT. So इन लोगों को मिला के कितने क्वेश्चंस हो जाते हैं? 162 plus derma was 5, 167 and ENT was 7. So it consists of 174 questions. So you are going to get 174 questions from these subjects only. Approximately means 175 questions you are going to get from all these subjects only. So if you are in short of time, do all the majors, preclinical and the high yield shorts, that is the derma and ENT. You are going to get 175 questions and you are going to get maybe decent rank if you study them properly. Follow the important topics list that I am going to give in future. I am going to make a video in future having all the important topic list for NEET PG, FMGE and INICET all combined in a list. Still now, if you want to go to my Telegram channel. The link is given in the description box below. There is an important topic list that I had released previous year. So you can get that from the Telegram channel itself. And when you are in a short of time, you can go through them, or in the last 10 days of preparation you can go through them, the list. Focus on the previous year questions, most importantly the last 4 years of NEET PG. अगर कोई PYQ करने का टाइम ना मिले, then also do the last 4 years of NEET PG and try 2 years of FMGE also. Okay, अगर कोई भी करने का टाइम ना मिले, ideally you should do about 8 years of NEET PGs, 5 years of INICET and 3 years of FMG. But if you lack a totally lack of time, if you are having, then go for 4 years of NEET PG and 2 years of FMG. Competition is going to rise, and next year also it is going to rise. Maybe in the 560 marks, the cutoff may rise to about 12,000. ओके ऐसा पकड़ के चलो कि 12,000 हो जाएगा 560 मार्क्स से. सो competition is going to rise and you have to prepare ahead of the competition. You have to be ahead of the competition and give focus on the weak subjects if you want to get a top rank. Don't just focus on the high yield subjects. If you are going to get a top rank, or if you are dreaming to get a top rank, then you should also focus on the weak subjects. So I think this summarizes the video. It took a lot of effort, so like it guys and share it with your friends. And you can see 2 videos popping up. One of them is the top 100 questions and the important topics for NEET PG. So go watch them now. All the best, and all the best for your NEET PG and FMG exam.